Okay, hi, I'm Dr. Chris Fortner. I'm the CF Center Director and Pediatric CF Program Director at SUNY Upstate in Syracuse, New York. And I'm going to give another update on COVID-19 in our area. I've been given these since very early in the March 2020, early days of the pandemic. This one, I will have a little bit less CF specific information, but a little more information on the current variants affecting our area. We'll talk about Omicron BA1 and BA2. So, quick overview. Start by talking about the number of cases in our area, and then I'll give some updates on vaccines, including local vaccination rates, monoclonal antibodies, antivirals, variants, and then some closing thoughts. So these are the sources for the numbers: the Johns Hopkins dashboard, the New York State Department of Health website, the county website, and the CDC website. So you can verify any of the numbers against those sources or get more up-to-date sources. So it's been about 6 weeks since our last update. And as of today, there have been over 480 million cases worldwide, with 79 million in the United States. That's up about 2 million since the middle of February in the US. In New York, we've had almost 5 million cases, and it's up 98,000 since the middle of February. And if you remember, February, we had gone up by like 30,000 since before the Christmas holidays or the winter holidays. Onondaga County is now over 100,000 cases. And we've seen 4,000 plus cases in the last 6 weeks. Our testing, as of yesterday, New York's run over 104 million tests. Onondaga County's run over 2 million tests. We ran almost 2,600 yesterday. And at least here, 8.2% of those tests were positive. And on the subject of positive tests, the county website is now cautioning folks that it may appear more positive, like we may have a higher percent positive because many people have been using tests at home. And if they test negative at home, there's no expectation that they report those results to the Department of Health. So there may be a lot more negative tests happening out there that are not getting turned in. But even still, that 8.2% positive is actually up compared to February. So moving the wrong direction a little bit. Central New York region is a little bit more positive than it was, like higher percentage positive. Finger Lakes is a little bit better, and Southern Tier is a little bit better. You may have seen on the news that right now, Central New York is at a higher positive rate than really anywhere else in the state. So in terms of new cases by report date, the last time we did this talk, we were here in February, over here to the side, and things were looking pretty good. They seemed to be leveling off. Not necessarily getting better, not necessarily getting worse. I would say now there's a pretty obvious trend of getting worse. The numbers are still bouncing around a bit by testing day, but they are definitely increasing. And that's for anyone who doesn't want to continue to deal with the pandemic. Cases going up pretty much guarantees we're going to continue to deal with the COVID-19 pandemic. So not something I wanted to see, but also, if you remember last time, I sort of predicted this was on its way. Because we've released a lot of our mitigations. We no longer require masks in public buildings or schools, and you still see people wearing masks. There's no doubt about that. But if they're not required, a lot more people are not wearing masks. And with this virus, as has been true from the beginning, there are a couple of days when you can be contagious but not feel sick yet. So it's fairly sneaky in that regard. This is our current hospitalization situation. And this too has leveled off. I am concerned that if we update in a few weeks, our hospitalization rates are going to go up. Leveling off is not a good thing unless we are down here at zero, but we have not gotten to zero. We've gotten close, but we've not been to zero ever since this thing began in 2020. The multisystem inflammatory syndrome in children, that was one of the concerns, especially in our area and especially early on, like the winter wave of December 2020, we saw a lot of cases of it. And with the Delta wave last August, we saw some cases. But as I mentioned, I was not expecting as much of a surge for whatever reason. I don't think the Omicron BA1 is as inflammatory nor as immunogenic. So sort of like I predicted, we didn't see a huge spike, even though we saw the huge spike in cases. This is nationwide, by the way. So across the US, huge spike in cases, but no real change. You were still seeing some MIS-C cases, about 10 per week, but that did not go up to parallel, even if you looked at the delay, because often your case numbers go up first, like here, case numbers went up, and then a couple weeks later, the inflammatory cases went up. We're not seeing that with the Omicron. I'm going to call it the Omicron BA1 spike because that Omicron spike is about to be replaced by a new Omicron spike. And I wish they would assign a new letter, but so far they have not. So what's the impact on our CF clinic? We've actually seen some improvements in restrictions. The hospital still expects people to be masked, and that makes perfect sense. Do you want to be in the same building with somebody who's coming in because they feel sick? They may have the flu, they may have COVID, they may have, stomach bug, who knows? But if you're in a building with sick people, it's in everybody's best interest to wear a mask. So for our clinic, we're still on the 5th floor of the Krause POB, and we're still providing surgical masks when you enter the clinic. The visitor restrictions of what has improved. Hasn't changed for clinic appointments or ER visits, still one adult support person for our clinic patients, and still 2 parents or guardians for the pediatric inpatients. But for the adults, the visiting hours have been expanded. They were only 3 to 7 p.m. Now they're 12 to 8. And they've expanded the number of different visitors that can come and go throughout the hospitalization. So it's still only 1 person per day, but there can be up to 4 different people who are allowed to visit over the course of the hospitalization. If somebody is in there for an extended course of antibiotics or something, up to 4 different people can rotate days visiting during those hours from 12 to 8. Our labs remain open, and we're very thankful for that. So this is not really new. I did update the New York State vaccination rate. It went from like 74 up to 76.1. So not a huge jump in our vaccination rates in the last 6 weeks. But that website at the top, this vaccine finder, if you are looking to get a vaccination, that's where I would start. Vaccinations by age, I showed this last time. This is a little bit better, but still, if you look at the 5 to 11-year-olds, the sort of elementary and early middle school kids, they are only about 35% vaccinated in terms of both doses of an mRNA vaccine. That's only up from 30% last time we talked. So better in the older kids, very good in our 65 to 74-year-olds in the community. But if we're relying on the vaccine protection to keep people out of the hospital, I think it seems to me that more people are relying on, my kid is young and should tolerate this better than an older person. But we know that some kids get really sick with this. So of the vaccines, what is new? Nothing new on the approval below age 5. I have not heard if Pfizer has completed looking at the 3-dose series and submitted that to the FDA yet or not. I don't believe they have, but it is still authorized down to age 5. Booster doses are approved for people 12 and up who are at least 5 months out from their second dose. And I'm hopeful. I've seen some news stories hinting that we may see a fourth dose approved for people who are 50 and up as soon as this week. And the reason I say I'm hopeful for that is on some of the later slides, I'm going to show you the breakthrough infection rates are going up. And I think fading immunity from boosters, because I got my booster back in October, early October. So I know, I mean, I haven't done blood tests to find out, but I am all but certain that my antibody levels are waning with time, because there have been a lot of good studies. There was a recent one this week from the New England Journal on antibody levels in the UK before and after a fourth dose. And there's a definite waning of antibody levels before the fourth dose is given. Fourth dose boosts it up again and sort of restores protection against some of the Omicron variants, at least in terms of protection from hospitalization. But the dose for the kids is quite low. It's a third of the adult dose. And for anyone who had concerns about myocarditis, or if there were heart histories in the family that you worried about, they are actually recommending spacing dose 1 and 2 a little further apart. That happened, it was seen more in the teenagers and like college age athletes, especially males. But if that is a concern of yours that's holding you back from getting a vaccination, they saw a significant reduction in the incidence of myocarditis if you spaced the doses more than 3 weeks apart. They actually recommend 8 weeks between dose 1 and dose 2 if there's a concern for, a congenital heart problem or other populations that would be at high risk of severe illness from myocarditis. So I guess there was more progress on vaccinations than I thought this week. There is still FDA authorization to use 2 other vaccines, either Moderna with a booster, or if you got the J&J 1-dose vaccine in the beginning, that is still authorized, but they recommend a booster to follow that up. And that booster can be anywhere 2 months from the original J&J vaccine on out. This is what I was talking about with the breakthrough. And in terms of dates, this is 90% effective, dropped down to about 80. This was in the time of the Delta variant back in August. Then this was the big Omicron spike that we had in December, January. And you can see the vaccine held up pretty well against the number of cases. So against breakthrough cases, it held up even better against hospitalizations. But now you can see as we're getting out here, and the gray and darker gray, that's because there's less data. Like data is still being collected for the week of March 14th and compiled, but we're starting to see that the vaccine effectiveness is fading. Could be fading for 2 reasons, 2 main reasons. Reason 1, again, if you got your booster really early, like I did, your antibodies are fading with time. Reason 2, and I think this is probably the bigger driver of that drop, is we are seeing a rise in Omicron BA2. And I'm going to talk about the variants a bit more in a few slides, but BA2 seems to be even more immune evasive, even more evasive of the antibodies, whether they are monoclonal antibodies or vaccine-derived antibodies that our bodies have made. So as breakthrough cases are going up, start looking for a need for a booster, or to re-implement some of the non-pharmacologic, non-vaccine protection strategies that have worked throughout the pandemic. Speaking of the monoclonal antibodies, these were a big deal in the beginning. We had a couple of options that neutralized the original strain, the Alpha variant, and the Delta variant, but the Eli Lilly doesn't neutralize Omicron and is no longer authorized. The Regeneron product doesn't neutralize Omicron and is no longer authorized. GSK has one. It neutralizes Omicron BA1, but not BA2. And because of that, just a couple days ago, they revoked authorization for use of it in our region, the Northeast, Maine, New England states, and New York. So because we have more BA2, we have no reason to pursue the GSK product, and we're not going to get resupplied from the manufacturer of that. So we'll have to rely on other approaches to try to avoid hospitalizations. One of those or two of those are the antiviral pills. I talked a lot about these last time, and I won't read the whole slide to you. Just know that the Merck product only seems to reduce the risk of hospitalization by about 30%, and it's authorized for people 18 and up. I spelled that wrong. It's Paxlovid with a D instead of an R, but Paxlovid by Pfizer is about almost 90% effective at reducing the risk of hospitalization or death. This seems to be holding up, at least for Omicron BA1. And based on its mechanism of action, I don't see why it wouldn't hold that same effectiveness against Omicron BA2. But it has to be given within 3 to 5 days of symptom onset. So if you feel like you might have COVID, get a test. And this is what the White House was talking about with its test to treat plan, where you get a test at a pharmacy and you get the treatment at the pharmacy. Seems like a great idea. I hope we can ramp up the necessary supply chain and treatment pathways to make that happen. But this one is authorized down as young as 12 years old. So for our adolescent CF patients or some of my asthma patients, I have used this Paxlovid product, and at least for them, we've kept them out of the hospital. So that's with significant underlying lung conditions. So on to the variants. Everything in the country right now is Omicron or its substrains. And that's why we got rid of the monoclonals that don't work against Omicron. But the main substrain we'll talk about is BA2. And if you look at the color bars over time, this orange one, this was the fading out of Delta. Fading out is really the wrong word. This was Delta being replaced by Omicron, and really by mid-January, it was almost all Omicron. Certainly by the beginning of February, it was all Omicron. And we're starting to see not just the BA1, which is the darker purple, and another substrain, but we're seeing a rise of this faint purple, the BA2. So why is it rising and the others are falling? It's not that these are necessarily fading out or that they've run their course and burned through the population. It's BA2 is taking over because it is more contagious. So it is spread more easily, and it is essentially out-competing for vulnerable people. So it's worth keeping an eye on this variant. I'll recap a little bit about BA1, which was the one we talked about last time. It did quickly replace the Delta variant. And based on the speed of overtake, we estimated it was about 4 to 6 times easier to spread than Delta. And you know that Delta was easier to spread than Alpha or the original. So the R0 for BA1 is quite high. It's more than 7, but it may not be as high as some of the original estimates that had it at 20 to 40 times. And what's the R0? If one person is infected, how many people are they likely to infect? So the other reason that Omicron may not have hit an R0 of 20 or 24 or higher is simply because we do have a decently vaccinated population, not so much in the kids, and certainly not in the kids under 5, but with some level of community protection, that means not everyone is vulnerable. So it's not as easy to spread. So its effective R was not as high. But the reason it grew and overtook Delta, it had a bunch of mutations in the spike protein, and it looked very different. And that's why the monoclonals didn't really recognize it. and the breakthrough cases was higher if you had not been boosted. It had a unique feature in that the PCR looks for 3 targets. One of them is the S gene, one of them is the N terminus, and I forget the third, but I'm sure you can look that up. But for Omicron, the way it was easy to know that it was BA1 was it had 2 positive like PCR signals and 1 that was missing. Whereas if you don't have it, if you don't have any coronavirus or COVID-19 in your system, all 3 of those bands would not appear. So that would be negative. If you had Delta, all 3 of those bands would appear. So that would be positive. But this one had only 2 of them with a dropout of the S gene. So on to BA2, it is now quickly replacing BA1. And it seems to be about 1.4 times easier to spread. Or if you want to say the number in a scarier way, about 40% more contagious. So its R0 is even higher than BA1, but I don't have any consistent estimates yet. They are truly all over the place when I search. So it does have about 28 differences compared to BA1. And there is documented cases of reinfection. Even after people had BA1 just a few weeks ago, they can catch the BA2 strain because it is different enough to the immune system, or perhaps because BA1 didn't generate a big antibody or immune response. This was definitely seen in England, and this was one of the New England Journal articles also. They're seeing about 6 to 9% of their entire population testing positive for BA2. And they had a pretty big BA1 outbreak not too long ago. We'll look at England's numbers in a bit, but at first I was worried that having BA1 was no protection against BA2. It's not that bad. The breakthrough rate that has been published in larger studies, countries that have had more cases of both of them, the breakthrough rate seems to be about 5%. So if you had Omicron in January or February, you could catch Omicron again as the numbers go back up and we have more BA2 in the area, but it's not as likely. So you've got only a 1 in 20 chance of having a breakthrough case if you had BA1. What is interesting is that S gene that we were just talking about, it amplifies again. So that's why you may read some articles that describe this as stealth Omicron, because Omicron was pretty clearly defined by having only 2 out of the 3 positive. Now we're back to all 3 positive, but it's still an Omicron strain. But it looks, from a PCR standpoint, it looks like Delta or Alpha or the original strain. So it doesn't look like Omicron BA1 on the PCR. So that's why some news articles are calling it stealth Omicron. I think mostly they're calling it that because it sounds scary. So like I said, there are no monoclonals that are currently approved for BA2. Nothing seems to bind it potently enough to reduce the risk of hospitalization. I am concerned that BA2 is likely to generate a more severe illness than BA1. Sorry, that's a typo. BA2 is more likely to generate a severe illness than BA1. And I say that based on what's been seen in other countries, including Hong Kong, South Korea, New Zealand, England, Denmark. Pretty much any country that has had a rise in BA2 cases, within a few weeks, they're not only seeing a rise in hospitalizations, they're seeing a rise in deaths. And in these updates, it's pretty rare that I've talked about the deaths. They have certainly happened, but I've tried to focus more on prevention and ending the pandemic versus how many people it's wiping out. But this is another chance for us to learn from the UK. And I've emphasized that since the beginning, pay attention to what's going on in other countries, because whatever's going on in other countries is only a short plane ride away from here. And so in the UK, this was their BA1 spike. And right around this lowest point, England got rid of all of its mitigation strategies. So no mask requirements, no masks in school. They just did about what New York is doing and said, you all know what's best, do what's best for yourselves, let her rip. And rip it did, or rip it is in England. So now that BA2 is on the scene, they are seeing not only a rise in cases, but you can also see their death rate is starting to tick up as well. It's not as dramatic as we've seen in Denmark or Hong Kong or South Korea yet, but if the cases don't get better with BA2, I think your death count is going to get worse as well. I don't think it's going to be this mild little blip. If the case count ends up even close to as high as they saw for BA1, I'm afraid the deaths are going to be quite a bit higher than we saw for BA1. So that's what I'm gleaning from international data. And right now, I don't have a good feeling about this variant. I'm very anxious to get well, not anxious. I am ready to be at the front of the line to get my 4th dose, because as these cases rise around here, and it's about to become the dominant one, meaning more than 50% in Onondaga County and the Syracuse area. So as those cases rise around here, I would rather be rocking a brand new 4th dose with big time antibodies to keep me well than trying to make do with last October's antibodies. So on to my closing thoughts. Last time it was staying safe, even if the world was opening up, earlier than I thought it was safe. Now it's staying safe, even if the world around you is catching on fire again. And that is actually, I believe, what we're at the beginning of seeing. You can't really argue about the Onondaga County numbers. Maybe the numbers in your county have not had the obvious upswing yet. Even if you look at the US as a whole, we haven't seen that upswing yet. We're going to see it around the same time of year as we saw the alpha bump. So, April, May, Easter, that time of year, we're going to be seeing the rise and hopefully the peak and start to fall of BA2. But the world's starting to catch fire again. How do you keep your fireproof coats on and all that? First of all, I want to urge you, if you're looking at what's the risk outside, what's the risk to, not wearing a mask? The CDC recently introduced these community levels, which I did not even include a link because I think they are absolutely useless. I would rather you pay attention to the community transmission. What the community level does is it makes things not look so bad. So if you're a politician who's trying to reassure people to be happy and it'll be all right, community level says it'll be all right. We're not likely to overwhelm the hospital or have massive daily deaths, but it's only got 3 levels. It's got high, like we've got out in eastern Montana. It's got medium, which is like we have in Onondaga County, that's kind of yellow, and also most of spotty parts of Texas and Kentucky, or it's this blue low level. So don't use that. It just provides no guidance. And what I mean by provides no guidance, by the time it has gotten yellow or red here, cases are going up. You may not have overwhelmed your hospitals yet, but you're doing nothing to prevent that. So if you look at community transmission, on the other hand, this is the one that had the 4 different levels, blue being low levels of transmission, yellow moderate, orange substantial, and red high. I'm going to zoom in on New York on the next slide. And you can see most of New York it looks like everything's great if you look through the Don't worry, be happy filter. But if you look at community transmission, very few, no areas have low transmission rates. Most are substantial or high. And if you remember back to last summer when Delta was coming out, the CDC recommended indoor masking when you lived in an area that had substantial or high community spread. We have not been out of those colors or out of those levels of spread since August of 2021. So just because you paint the map a different color does not change that we are still at a level of transmission that wearing a mask indoors is one of your best bets. So protect yourself. This doesn't mean don't gather. With the next few days weather being a little colder, yeah, we're going to be doing more indoor things. However, we're about to have a fantastic spring up here. So outdoor gatherings, if you're going to do an Easter celebration, Easter's later this year, should be nice and warm, fingers crossed, and be outside. Memorial Day, outdoor. 4th of July, outdoor. More things outdoor than indoor. It's just safer outside. I would recommend, if you're having a major indoor gathering, like a wedding or a large graduation party, or even just a family graduation party that's pulling people in from different states. We just had family in for a celebration that came from at least 3 different states and had to, some flew to get here, some drove to get here. The people in the room touched on about 8 different states in the week before they arrived. And so before we took off our masks for dinner, everybody did the home kit. And for Omicron, I highly recommend use the same swab, but do a throat sample first, then a nasal sample, because it can build up in the back of the throat faster and get a positive result, even if you test negative in the nose only. So I would say swab your throat, followed by your nose, and then run the home tests. But after we all, almost a dozen of us had negative tests, then we took off our masks and we enjoyed dinner together. We actually enjoyed the rest of the weekend together. We didn't go to separate places. We brought in food to enjoy together. So I would consider pre-testing before major indoor gatherings. I'm less concerned about outdoor, obviously. But the big thing from the beginning of this whole thing, try not to inhale someone else's exhaled air. It sounds kind of gross when you think about it anyway, but that someone else who's exhaling, they may not know that they're blowing out, COVID aerosols because they haven't developed symptoms yet. So try not to inhale someone else's exhaled air, whether that's close face-to-face or in an enclosed room where you've all been breathing for several hours. Masks still do help. There's data from the CDC that people who wear masks, whether it was cloth or surgical or N95s, much less likely to test positive if you wear a mask all the time indoors. Find the best fitting one you can that provides the most effective filtration. This is a link I included last time. If you are going to be buying like KF94s from Korea or KN95s, early in the pandemic, there was some problems with forgeries, masks that said they were those, but didn't have that filtration. I don't think it's as big of a problem now. However, with cases spiking over in Korea and China, those KF94s and KN95s may not be as readily available anymore. They may not want to be shipping them to our country when they need them in their own. So I would be careful to use a reputable brand. And by reputable, that link I provided, you can see they tested them and found what level of particle filtration they performed at. So that's my quick thoughts on where we are. I would absolutely love for the people who are pretending this is over to be right, but none of the data says that that's going to be true. I wish I didn't think that it will get worse again before it gets better, but it's going to. And I maintain hope that, June, July, maybe even August, in this region of the country, we will be doing as well as we were last summer, if not better. I would love to finally turn the corner on this, but because we keep seeing more contagious or more evasive or sneakier versions and sneakier variants, we just need to do what we can to keep doing the things we love with the people we love without increasing the number of cases or prolonging the pandemic. So thanks for listening. Have a good rest of whatever part of the day you're listening during. Thanks.